What if I told you that most people having a heart attack could have actually predicted it a few hours before it happened? Crazy, right? Well, everybody knows what a heart attack looks like. Sudden pain in the chest, it shoots to the jaw or the left arm, and you're struggling to breathe. We get all that, but that's not what I'm talking about. I'm talking about clear signs that happen hours before you need to call the ambulance. In this video, I'm going to tell you 5 hidden signs that you need to be aware of to know if you're likely to have a heart attack sooner than you think. Stay until the end because I'll also share the best way to actually know your real risk of a heart attack. I'm Dr. Ford Brewer. I'm a preventive medicine physician. I used to run the prevention program training doctors at Johns Hopkins, and I've been doing prevention for over 40 years. Now, let's get started. Sign number 1, dizziness or lightheadedness. Let me tell you a short story. This is Gary. Gary, like a lot of my patients, came to see me after he already had his first heart attack. He was trying to avoid the next one. When I asked Gary if he had any warning signs before that heart attack, he remembered it very clearly. He said, suddenly felt off balance a few times, like his head was floating in the air, especially when he got up from the chair and when he rolled out of bed in the morning before it happened. It wasn't really bad enough to make him feel fall or pass out, but it definitely made him feel just uneasy. I asked him if he had nausea or vomiting or, palpitations, thumping in his chest. He said, no, it just felt kind of off. He figured it was just getting older, maybe low blood sugar, so he did what most folks do. He ignored it. Here's the problem. It sounds so random that most people don't connect it to the heart, and they don't even think about a heart attack, but they need to. A study published in Neurology showed that up to 10% of people experiencing heart attacks report dizziness as one of their very first symptoms. Now, that might not sound like a lot, but when you're talking about millions of people at risk, it starts to add up. Now, what does balance have to do with heart disease, heart attacks, anyway? Well, here's what's going on. When your heart isn't pumping like it should, either because of a blocked artery or an unstable rhythm, it can't keep up with the demands for oxygen from your brain. Your brain is picky. It needs a steady flow of oxygen-rich blood, and it needs it fast. So when cardiac output drops, even just a little bit, cerebral perfusion takes a hit. And pardon the geek term there, cerebral perfusion, that's just a medical way of saying your brain just ain't getting the oxygen that it needs. What you feel is lightheadedness, disorientation, maybe even that sense that you're about to black out. And here's the key. For it to be a heart attack alert, it usually needs to be a sudden event, and it needs to happen during activity or when you're standing up. Now, I'm not saying all dizziness predicts a heart attack, but it's definitely a sign you shouldn't ignore. Number 2, cold sweats or clammy skin. Let me tell you about Ron. Ron had not 1, but 2 heart attacks before he came to see me. They were 6 months apart. He said that during the first one, he was sitting in the recliner watching a ball game. All of a sudden, he broke out in a cold sweat, and his team wasn't even losing. So his shirt began to stick to him, his arms felt clammy, and it was weird because he didn't feel any weakness, any dizziness, any pain. He just felt off. He said, Doc, I thought maybe I was coming down with something, like I was going to have the flu the next day or something. That moment scared him, but only for that moment. He started to feel better again, so he shrugged it off and he did what most people did in this situation. He ignored it. That's what most people do. They say, well, it was nothing. And I get it. You're sitting still. There's no chest pain, no shortness of breath. Who would think I'm having a heart attack? Well, Ron had his first heart attack about 24 hours after that symptom. And here's the crazy part. 6 months later, it happened again. This time, Ron recognized the pattern. He went to the hospital, to the ER and got immediate care. Fortunately, that second heart attack wasn't as bad as the first. Now, does this really happen? Of course it does, and a lot. There's a study called the SWIMI study, SWIMI. Researchers looked at over 10,800 people having heart attacks. Nearly 91% of those with complete blockage broke out in a cold sweat. That makes it one of the most predictive warning signs out there, right alongside chest pain. And here's the tricky part. It often happens alone. That's why so many people just miss it. Now, what's happening to cause this? Well, so when the heart's struggling to pump blood from a blockage, a spasm, or a drop in oxygen, the body hits the panic button. That panic button is your sympathetic nervous system. It's the same one that fires up when you're in danger. It's adrenaline, norepinephrine. These are hormones designed to keep you alive. They raise your heart rate, tighten your blood vessels, and shunt blood toward your organs, your vital organs like your heart. Now, there's side effects. You start sweating, you get cold and clammy, and it's the same biological alarm you'd feel if you were facing danger, like a bear's coming after you, except this time the danger's coming from inside your chest. So if you're sitting still and suddenly feel cold, wet, clammy, shaky, that's your cue. Don't walk it off. Don't wait it out. Call for help. Sign number 3, stomach ache. Let me tell you about Brian. Brian's a 45-year-old man who came to see me a year after his heart attack. He said he'd had just a sour stomach for a few days before all this happened. He figured it was the leftover chili he nuked for lunch. He said it kind of sat heavy, and it wasn't going anywhere. He had some belching, a little pressure, and it was in his upper belly, and he had a queasy feeling he just couldn't shake. He tried antacids. He skipped dinner. He just wasn't hungry, and the discomfort just stayed there. It didn't go away. And the next morning, he woke up with intense pressure in his chest, like an elephant sitting on it, like that stomach pain had moved up into his chest and jaw. He ended up in the hospital in the ER, and a couple of stents later, he learned the truth. That stomach ache, it wasn't from the chili. It was from his heart. Evidence shows that up to 26% of people, a quarter of people, when they have heart attacks, it presents first with stomach ache. That's not rare. It's one of the top reasons folks go to the ER. They think it's reflux or a stomach problem, and it's really a heart problem. Now, why does that happen? Your heart sits right above your stomach, and when the underside, the doctors call it the inferior side, the underside of your heart wall starts losing oxygen because of a blocked artery, it irritates nearby nerves and makes them fire. The vagus nerve, which connects your brain, your heart, your lungs, and your gut, misfires. And that misfire causes pressure, nausea, and even vomiting. It feels like indigestion. It's not your gut. It's not your stomach. It's your heart. This type of heart attack is more common in older adults, diabetics, and women. And it's often missed because, like Brian, he didn't ignore it, but he didn't connect the dots in time. He just said, I'm having a stomach ache and let me go to bed and sleep this off. He's alive today because he got help, but now he's alert to every new symptom. Sign number 4, fainting or seizure-like episodes. Now, this one's hard to miss, but pretty easy to dismiss. Most people will never connect fainting or seizure-like episodes to heart problems, but they should have. Take Derek. He's 70 now, but about 20 years ago, he had a heart attack. Back then, he was a high school coach, and one day, while grocery shopping, he just fainted. One second, he's picking out produce. The next, he's on the floor. Folks thought it was a seizure. He was gray and gasping, and by the time the paramedics arrived, he'd gotten up, he'd regained consciousness, and he actually felt fine at that point. He refused the hospital trip and said it was just a one-off, and he was very embarrassed. That almost turned out one of the biggest mistakes in his life, because later that night, he fainted again, this time at home. His wife was there. She didn't let him deny it. She didn't let him refuse a trip. She called 911, and he ended up needing a triple bypass. That's how fast this can happen. Derek was lucky, but studies show cardiac-related fainting is dangerous. If your fainting is heart-related, your risk of dying within a year jumps by 30%, almost a third. In a Danish registry study, 19% of young people who died from sudden cardiac arrest had already fainted at least once. Fainting might be your only warning shot. So what's going on? When a coronary artery gets blocked or your heart flips into a dangerous rhythm like ventricular tach, VTach, or VFib, ventricular fibrillation, blood flow drops to nearly zero in an instant. And your brain, you remember we mentioned before, your brain is an oxygen hog. It can't go more than a few seconds without oxygen. So the brain stops. If you go into a VTach or VFib, you're not getting oxygen to the brain stops working, you pass out. Sometimes your muscles jerk or twitch when you pass out like that, and it can look like a seizure. But it's really your heart not pumping fast enough to oxygenate your brain. If you faint and there's no clear reason why, no dehydration, no low sugar, no medications, that's not something to sleep on. That's not something to deny. That's not something to deny a trip to a hospital over. And it's not something to just go to the urgent care or the doctor's clinic. That's a 911 call, go to the hospital. Because the next time it happens, again, could be the last. Before I tell you the last signs, let me tell you something important. Remember I said there's a better way to know your risk for heart attack, to predict if you might have a heart attack? Well, if you're frustrated with your current medical care, you're not alone. I've been there. Years ago, I had to take control of my own health to avoid a heart attack and a stroke because the tests I was getting just weren't catching my risk. They weren't that clear. Traditional cholesterol and metabolic panels don't look at the root causes of heart attacks and strokes, or blindness or kidney disease or erectile dysfunction. That's why we created the Heart Reveal lab panel. We measure inflammation inside the arteries, inflammation, arterial or vascular inflammation, early insulin resistance, the subtle signs of metabolic breakdown. These things build up in your arteries years before diagnosis. So what happens is you first get a metabolic problem, that starts to damage your arteries, and then you may have a few years to get warning before you have like a heart attack. That's how to watch for this. Now, these are the markers that reveal where your health is truly headed, long before symptoms appear. Every set of results is reviewed by me and the clinical team. Then you'll meet with a trained advisor to walk through your report line by line. You'll understand what each result means and how to respond to it with practical steps that make a real difference. This approach gives you a clear picture of what's happening inside your body and a path to protect yourself from what's ahead. So if you're ready to stop guessing and start understanding your real risk, test, don't guess. Click below or scan the QR code if you're on a TV screen to get your Heart Reveal lab panel today. And if you're not quite ready for that, and that's okay, you can start by downloading my free Heart Reveal Labs eBook. You can start learning which tests actually help you to avoid a heart attack. Click that link below, scan the QR code, and now let's go to sign number 5. A sense of impending doom or sudden anxiety. Every now and then, the body gives you a signal that's hard to explain. Just a deep, unsettled feeling that something's about to go wrong. Impending doom. A lot of folks feel it in the hours or even a day before a heart attack, and they can't exactly explain why. And you say, is that real? Oh, yes, it's very real. There's a peer-reviewed study that found that 35%, over a third of women, and 20% of men, in other words, 1 in 5 men, reported a sense of impending doom or fear of death during the acute phase of a heart attack. It often showed up before the chest pain or shortness of breath ever began. So how is that possible? Well, here's what's happening. When oxygen to the heart starts falling off even slightly, the brain's limbic system kicks in. Limbic system, it's your emotional center. It gets triggered. You get a surge of adrenaline and cortisol, the fight or flight hormones that we talked about earlier. Even if you're just sitting on the couch and your body knows something is wrong, but it's not quite clear what's happening. It's a gut-level sense of fear. It's a panic. It's not just an anxiety. It's your nervous system picking up on cardiac distress before your conscious mind ever recognizes what's going on. So if you ever feel a wave of fear or panic that doesn't make sense in the moment, don't ignore that. That could be your early warning sign. Now, if you're ready to know what active steps to take to avoid a heart attack, check out this video right here.